The Pathology Laboratory Act 2007, Act 674. What is the Pathology Laboratory Act 2007, Act 674? The Pathology Laboratory Act 2007, Act 674, is an act to provide for the regulation and control of pathology laboratories and for matters connected therewith. This act is divided into 13 parts as enacted by the Parliament of Malaysia as follows. Part 1. Preliminary. Part 2. Control of pathology laboratory. Part 3. Approval to establish or maintain a pathology laboratory. Part 4. License to operate or provide a pathology laboratory. Part 5. Responsibilities of a licensee or person in charge. Part 6. Suspension and revocation of approval or license. Part 7. Closure of pathology laboratory. Part 8. General provisions relating to approval or license. Part 9. Quality of pathology laboratory. Part 10. Pathology Laboratory Advisory Committee. Part 11. Managed Care Organization. Part 12. Enforcement. And Part 13. Miscellaneous. Where does the Pathology Laboratory Act 2007, Act 674, was implemented? The Act is applicable to all private laboratories, which is the standalone or hospital and laboratories in statutory bodies such as universities and foundations. It is not applicable to public laboratories, which was established and operated by the government, and side-room laboratories established in clinics of registered medical or dental practitioners for their own patients. When was the Pathology Laboratory Act 2007 first proposed? The idea for legislative regulation of pathology laboratories was first proposed by the Malaysian Society of Pathologists, the predecessor of CPATH-AMM, in a memorandum to the Ministry of Health in 1983. Acceptance of this idea and the drafting of the bill took over the course of 24 long years, which is from 1983 to 2007. Let's discover the landmark events leading to the Pathology Laboratory Act 2007. It started with the presentation of a memorandum to MO in 1983 that pointing out the need for legislative control of laboratories. In the next year, 1984, MOH took a survey to private pathology lab to justify the need for regulation, and started the drafting activities. In 1987, the first draft completed, but there were some objections to it, and the objections were reversed in 1989. A few years later, in 1992, there was a submission by Malaysian Pharmaceutical Society to be exempted from Pathology Lab Act in performance of screening and monitoring tests. In 1994, MSOP took a survey on the aspects of pathology laboratories that is to be regulated, which include qualification of personnel, environment and safety, quality, EQA, etc. In the same year, the second draft was approved by Attorney General's Department. In 1997, consultation with professional bodies have been conducted, and there were some issues raised about walk-in testing and grandfather's clause for existing laboratories. The next year, 1998, the bill was redrafted to be in line with Private Healthcare Facilities and Services Act. In the year of 2000, the third draft was entitled as Pathology Laboratory Facilities and Services Bill, and consultation with professional bodies have been conducted for the second time. In 2002, the fourth draft entitled Pathology Laboratory Bill has been approved by Minister of Health. And in 2003, the first draft of Path Lab regulations has been approved by Minister of Health. A public consultation has been conducted in 2004. Fine-tuning of the draft bill was carried out from 2004 until 2006. In the year of 2007, the Pathology Laboratory Bill was tabled and passed in Parliament. Why is the Pathology Laboratory Act 2007 important? The Pathology Laboratory Act 2007 is important as it seeks to ensure that the pathology laboratory is accountable to the public, meets required standards of practice, which is similar to MS ISO 15189, participates in quality assurance programs, is run by qualified staff, such as pathologists, scientists and medical laboratory technologists, complies with safety requirements, and is subject to continuous audit. How is the Pathology Laboratory Act 2007 implemented? The Act regulates through the powers of the Director General of Health or DG beyond the Minister of Health to all private pathology laboratories and those in statutory bodies. The Act is empowered to regulate all pathology laboratory that conducts diagnostic, screening, and monitoring tests, as well as therapeutic drug monitoring and point-of-care testing. Excluded forensic, research, and infertility laboratories and those involved in product testing laboratories. The Act provides for control of the pathology laboratory through approval and licensing. An approval is granted to maintain a laboratory, which is a permission to build the laboratories, while a license is granted to operate or provide a laboratory, which is permission to start the business. The application for an approval and a license shall be made to the DG. The approval or license may only be issued to a sole proprietor, partnership, or body corporate, and then only if they include a registered medical practitioner. Each pathology laboratory requires separate approval and license. Besides that, the quality and competence requirements are similar to those of laboratory accreditation, which is MS ISO 15189. Once a license has been granted by the DG, the laboratory shall have another 6 months to comply with any terms and conditions, if any, imposed. Lastly, even though the Act grants extensive powers to the DG, any aggrieved person can appeal to the Minister of Health against the decisions of the DG, since the Minister of Health is empowered to make regulations to give effect to the Act.